Uh, Good morning, good afternoon, good evening, wherever you are in the world. I'm Larry Gostin. I joined with my wonderful colleague, Ben Meyer, to edit this book, and I had a great privilege to do that. I'm at the O'Neill Institute for National and Global Health Law at Georgetown University and director of the WHO Collaborating Center by that same name. Thanks so much for joining us. This is a wonderful day for us, not just because it's the launch of our book, but of course, we're joining on Human Rights Day, the anniversary of the signing of the Universal Declaration of Human Rights, to celebrate the publication of the book by Oxford University Press, Foundations of Global Health and Human Rights. Human rights are essential to global health. I think we've always known this, but we know it more now than we ever have in our modern history as we're experiencing the COVID pandemic with all of its potential for removing the human rights of ordinary people in every continent in the world. The field of health and human rights has a rich history, beginning with Jonathan Mann, and it's proven increasingly important both in local um, uh, action, national action, and in global contexts. Rising originally out of the advocacy in the early AIDS response, the rhetoric of human rights has long been central to public health engagement. But professionals from all fields, and all of our fields are very different, have to understand, have to operationalize the legal obligations of human rights for public health. That is, um, uh, it's a powerful language, human rights, but it's also a powerful obligation, an international and national obligation under law. This textbook is intended to support teaching on global health and human rights, and it arose out of our previous Oxford University Press volume that Ben and I developed on human rights and global health, the rights-based governance in a globalizing world. We compared the strategies developed by international organizations to advance human rights for global health in that book. And through that book, it became clear that there was no standard educational reference to support the practice of human rights in global health. And with the imperative for the education in the field, um, academics through many disciplines have sought to teach the subject in schools of law, medicine, public health, nursing, social work, international relations, and global studies. But there's never before existed a foundational textbook to support student education in the field. We're seeing rising challenges in an increasingly divided world. Ben and I felt that it was important to develop a textbook, um, not just because we want to empower our own generation, but more importantly, we wanted to empower a new generation, a new young leadership to sustain the global commitment to universal rights in global public health. And looking to that next generation, they will face many struggles ahead. Our book, Foundations of Global Health and Human Rights, with just an incredible world-class group of scholars and advocates as authors in that text. They provide a detailed understanding of the complex relationship between global health and human rights. And in preparing for the next generation to meet the increasing challenges in global health and human rights knowledge, it will be crucial to influence health policy, research, and advocacy, securing a future of global health with justice. And if there were one lesson from our book and one mantra that we want to pass on to the next generation, is to achieve a world of global health and equitable, just solutions to global health. Thank you very much, and I'll be back to you later with chapter 2.